Why do I recommend walking, stretching, and exercise for chronic low back pain? For all back pains, we know that a person with a good overall physical condition, good back and stomach muscle strength, and good flexibility will be less likely to develop a chronic back condition. If you have chronic back pain, I'd recommend staying active, walking, stretching, and exercising. There are some scientific basis for those recommendations. Let's first explore bed rest. While it may make sense to you, it turns out not to be that great a benefit. Make sure to limit bed rest to no more than 2 days. Research has shown that bed rest for 7 days will lead to muscle weakness and atrophy. You'll have a prolonged recovery and you'll be less likely to return back to your normal activities in a timely manner. Walking is a great way to strengthen your lower leg muscles, burn calories, lower blood pressure, and decrease emotional stress. Each of these components also help you manage the back pain-related concerns of muscle loss, obesity, and conditions including hypertension. In addition, walking helps you to stress your core muscles. While walking is not designed to build the core, it nevertheless helps with its maintenance. I recommend people to walk at least 15 to 20 minutes a day while recovering from back pain. It doesn't cost anything, it doesn't require any equipment, and most people can find at least that amount of time in each day. It comes down to desire and discipline. Regarding exercise, it turns out simple Pilates, yoga, planking, and Tai Chi improves the stomach and back muscle strength. That in turn helps with back pain, spinal stenosis complaints, and recurrence of back pain frequency and duration. Enough studies have shown that people who stick to an exercise program for at least 6 to 8 weeks show a decrease in intensity of back complaints. While there has been efforts to try to see if there's a difference between core exercises versus stretching alone, most will conclude the most important principle is to stay active. Stretching usually is associated with some stomach and back strengthening. The purists will argue that you must also add the specific yoga, planking, Tai Chi, and light weight training moves. For my patients, I just recommend walking, then supplementing with planking and stretching. I know this is a lot to consider. To make it simple, just stay active, move at least 20 minutes 3 to 4 times a week, gradually increase your amount of movement. It will make you stronger. Over time, it should help your chronic back pain. You will always have some back pain and recurrences should be expected. If your back and stomach muscles are strong, you will have shorter episodes and hopefully longer periods of reduced or no pain. I hope your back starts feeling better soon. Please be patient and focus on the improvements. The next video will discuss what to do if you don't get better.